To this UK drug testing and value med presentation video showing you the new Behemoth 17 drug cup from Alltest. Now when you purchase one of these kits, you'll have it presented to you in this standard Alltest branded foil, which is in front of you now. So the full list of 17 drugs that are included in this test are in this small print here, the lot number, expiry date and the standard CE certification. What you'll also be sent is one of these colour card or chart evaluations. Now that is because this cup includes a 3-pad adulteration test. Now adulteration tests are included to check that the urine has not been adulterated, diluted or substituted. So 3 of the parameters on the evaluation card will be included in that 3-pad test on the cup. Not all 6, because this card is a generic universal evaluation card which is used for a variety of different options that can be loaded. So make sure that you match it against the relevant and matching 3 parameters on your adulteration test. Let's open this foil up and show you the actual cup now. Okay, so inside the pouch you will find a test cup like this. This is an A3 design screw lid test cup, a nice rigid side wall with the test strips embedded, as you can see, circumferentially around the outside, with the urine sample being placed inside the cup. Once the urine sample has been obtained, the cup lid can be screwed firmly down and should be leak proof. Now initially the cup has this remove label in orange sticker covering the area where the results are going to be identified, and this allows you to either remove this before the urine's added or after the urine test has run at the read time. It prevents the donor necessarily seeing the test results. Now also on the reverse of the cup you will see 2 other elements. The temperature test strip here, which is a liquid crystal temperature check ranging between 32 and 38 degrees centigrade. These are the ranges that normal human urine should be at once it's gone into this cup. The minimum urine level indicator is here and corresponds with approximately 30 to 35 mils of urine. There is a graduated scale here, as you can see, the maximum being 105 mils. You would not want to fill the cup any further than that, but anywhere over the minimum level will be adequate. And the process is for this cup to be given to the donor. They may be offered a choice of different cups to select from in the process if you're doing this in a workplace setting, and then they go and produce the urine sample above that minimum level, and then you start a timer and read the results at 10 minutes. So let's run one of these cups, show you the temperature strip in action, and then show you the interpretation of the results. Well, now this container has had its sample added for approximately 3 minutes. I'm just going to show you the temperature test strip. You can see this one's indicating 34 degrees centigrade, 94 degrees Fahrenheit. The pads that come up aren't particularly bright, they don't glow at you, but you're just looking for that colour brightness in the square to indicate the temperature at which the urine is. And it doesn't matter if it's at any of these, but if you're getting any of these showing a reading, then that is an indication that it is at the expected body temperature. It will cool somewhat when it goes into a cold test cup, so don't expect it to be every time at 37 degrees. Now what we've got to do is wait for this test cup to run for a full 10 minutes. So what we're going to do is peel the label off and show you the result interpretation and the adulteration test pad checks when that time is up. So I'm going to stop the video now and come back when we have that specific time. Now this test cup has had the full 10 minutes development time, so we're going to peel off the label. And here you can see your drug test results with the control lines all along the top near to the drug abbreviations, which are clearly indicated on each test strip. The first check we're going to do is on the adulteration test strip at this end, and the first or lowest colour chart that we're matching here is the pH. So find your pH colour chart and match it. You can see that this is at 7, which is absolutely normal. Then we're going to move to specific gravity. And again, that's somewhere between those 2 within the normal range. And the final one is the oxidants test, which is on the reverse. And again, there's no sign of a dark blue or green change there somewhere in that range, so that's fine. So the adulteration tests are all passed on this sample. Doesn't suggest that the urine has been tampered with or adulterated, diluted or contaminated. And then you can look at all your drug test results, and the abbreviations for all 17 drugs included are listed in the instruction sheet that we send with you. This is a completely negative test result for all 17, as you can see. Nice clear test lines with control lines showing on each one. They're not picking up particularly well. It's always good to read these in natural light. Okay, and any test line showing in the presence of a control line, you'll see the variance in these test lines. Some are thick, some are faint, but they are all clearly present, and that indicates a complete negative test result for all 17 drugs. It is important that you give it the full development time as per the manufacturer's instructions before interpreting any as non-negative or positive indicators that the drug has been detected at or above the cutoff for the specific membranes. Now, all the detection times, windows, sensitivities, and all other information is on the bottom section of our website. So if you need further information to clarify how you do and interpret the results of this drug test and what to do when you hit a positive test, please read those sections, or feel free to contact our customer service team who are operating in the UK during normal office hours. Thanks for watching.